Good afternoon. This presentation is about fentanyl, which is a synthetic opioid that has become the leading contributor to mortality in the United States. I will review its history, epidemiology, clinical effects, and nursing implications, including an evidence-based care plan. Fentanyl is a highly potent synthetic opioid originally developed for severe pain management. While the pharmaceutical fentanyl remains clinically appropriate, illicitly manufactured fentanyl now dominates the drug supply and is responsible for the majority of opioid-related overdose deaths. Fentanyl's misuse evolved from prescription diversion to widespread illicit production. Since 2013, IMF has fueled a dramatic rise in overdose deaths, marking the third wave of the opioid epidemic. Recent CDC surveillance data indicates that fentanyl is implicated in more than 70% of the opioid-related overdose deaths. Its presence in counterfeit pills has increased mortality among adolescents and young adults. The risk factors for fentanyl misuse include prior opioid exposure, co-occurring psychiatric disorders, and social determinants such as homelessness and trauma. Adolescents are increasingly vulnerable due to the counterfeit pill exposure. So some of the short-term effects mirror other opioids, but occur more rapidly due to fentanyl's high lipid solubility. Respiratory depression remains the most life-threatening. Long-term fentanyl use leads to significant physiological and psychological consequences, including opioid use disorder and increased infection risk among individuals who inject drugs. Assessment should include both physical and behavioral indications. Respiratory rate is a critical assessment parameter, as fentanyl-related respiratory depression can progress rapidly. Fentanyl overdoses often require multiple doses of Narcan due to its strong receptor affinity. Rapid recognition and intervention are essential for survival. These diagnoses reflect the acute and chronic risk associated with fentanyl use. Respiratory compromise remains the highest priority in nursing assessment and intervention. Medication-assisted treatment is a gold standard for opioid use disorder. Buprenorphine and methadone reduce the craving and stabilize neurobiological pathways. So the non-pharmacological treatments include CBT treatment, motivational interviewing, contingency management, harm reduction, peer support, and case management. So education should be non-judgmental and practical, teaching patients how to recognize overdose signs and administer Narcan can significantly reduce mortality. Referrals should address the full spectrum of patients' needs, including mental health, substance abuse treatment, and social determinants of health. Consistent follow-up improves treatment retention and reduces overdose risk. Interdisciplinary collaboration is essential for comprehensive care. In conclusion, fentanyl is still one of the most urgent public health challenges, and nurses play a significant role in prevention, early identification, and evidence-based treatment. And here are my references, and thank you for watching.